Hello and welcome. Today we're delving into the world of urology to discuss a relatively uncommon condition called ureteral polyps. We'll explore what they are, why they form, how they're diagnosed, and the options available for treatment.
So, let's get started!
The exact cause of ureteral polyps isn't always clear, but several factors are believed to play a role. Chronic inflammation is a major suspect, often stemming from recurrent urinary tract infections or even the presence of kidney stones. Genetic predisposition might also increase someone's likelihood of developing these polyps. In some rare instances, they can be associated with genetic syndromes. Exposure to certain chemicals or toxins has also been theorized, though more research is needed to confirm these links. It's important to remember that in many cases, the origin of a ureteral polyp remains idiopathic, meaning the specific cause is unknown. Understanding the pathophysiology is crucial. A ureteral polyp is essentially an abnormal growth of tissue that protrudes from the inner lining of the ureter, the tube connecting the kidney to the bladder. As it grows, it can obstruct the flow of urine. This blockage leads to hydronephrosis, a swelling of the kidney due to urine backup. Prolonged hydronephrosis can damage the kidney, potentially leading to impaired function over time. The polyp itself is typically benign or non-cancerous, however, in rare cases it could have malignant potential. The polyp's size, location, and number all influence the severity of urinary obstruction and the resulting symptoms. Ureteral polyps are considered a relatively rare condition. It's difficult to pinpoint exact numbers because many cases are asymptomatic and go undiagnosed. They can occur in people of all ages, but are more frequently diagnosed in adults, particularly those between 40 and 60 years old. There doesn't appear to be a significant difference in prevalence between men and women. Further large-scale epidemiological studies are needed to get a better understanding of the true incidence of ureteral polyps in the general population. The signs and symptoms of ureteral polyps can vary greatly depending on their size and location. Some individuals may experience no symptoms at all, especially if the polyp is small. However, as the polyp grows and obstructs urine flow, symptoms may appear. Common signs include flank pain, which is pain in the side or back, often described as a dull or sharp, stabbing sensation. Hematuria or blood in the urine is another possible symptom. Recurrent urinary tract infections can also be indicative of a ureteral polyp. In some cases, the polyp can cause hydronephrosis, leading to abdominal swelling and discomfort. It's important to consult a doctor if you experience any of these symptoms. Diagnosing ureteral polyps typically involves a combination of imaging techniques. A CT urogram, which uses X-rays and contrast dye, is often the initial imaging study of choice. This allows doctors to visualize the ureters, kidneys, and bladder and identify any obstructions or abnormalities. A retrograde pyelogram, where contrast dye is injected directly into the ureter, can also be used to provide detailed images. Ureteroscopy, which involves inserting a thin, flexible tube with a camera into the ureter, allows for direct visualization of the polyp, and a biopsy can be taken for pathological analysis to confirm the diagnosis and rule out malignancy. While ureteral polyps aren't formally classified into distinct types in most medical literature, they can be described based on their characteristics. They are usually categorized by their size, location within the ureter, and whether they are solitary or multiple. In terms of composition, they are generally benign fibroepithelial polyps. However, it is vital to conduct a biopsy to rule out the possibility of malignant or premalignant lesions. Sometimes what appears to be a polyp might be a different type of ureteral tumor, so histologic examination is essential. The treatment of ureteral polyps depends on several factors, including the size and location of the polyp, the presence of symptoms, and the overall health of the patient. For small, asymptomatic polyps, observation with regular monitoring may be sufficient. However, if the polyp is causing symptoms or significantly obstructing urine flow, intervention is usually necessary. Ureteroscopy with polyp removal is a common approach. This involves using a small camera and instruments to excise the polyp. In some cases, open surgical removal may be required, particularly for large or complex polyps. After removal, a stent may be placed in the ureter to promote healing and prevent scarring. Regardless of the method, close follow-up is crucial to monitor for recurrence. Unfortunately, there's no definitive way to completely prevent ureteral polyps, given that the exact cause is often unknown. However, certain measures can help reduce the risk of developing conditions that may contribute to their formation. Staying well hydrated to prevent kidney stones and urinary tract infections is crucial. Prompt treatment of urinary tract infections is also important. If there is a family history of ureteral or urinary tract abnormalities, genetic counseling might be considered. Maintaining a healthy lifestyle and avoiding exposure to known urinary tract irritants may also be beneficial. Regular checkups with a physician can help detect and address any potential urinary tract issues early on. The prognosis for individuals with ureteral polyps is generally good, especially with prompt diagnosis and appropriate treatment. Most polyps are benign, and recurrence after removal is relatively uncommon. However, long-term follow-up is essential to monitor for any signs of recurrence or complications. Recent research is focusing on developing less invasive techniques for polyp removal, such as advancements in ureteroscopic instrumentation and imaging. Additionally, researchers are investigating the molecular mechanisms that drive polyp formation in hopes of identifying potential targets for preventative therapies in the future.